Good morning or good afternoon, depending from where you join us. Hello again for our Symposium 2020, a year without public space, reflections and outlooks. We are continuing basically with a topic of the last session in the morning in terms of looking at cities and health. I want to look now specifically how to create healthy communities. So we have again also speakers from similar countries like before, also from Auckland and from Australia and Hong Kong. And Kevin will introduce the speakers in a minute. I just want to mention two things that also particularly the work also in this session and in the last session is very much linked to our Worldwide Universities Network project. So WUN also funded this symposium, and it's a way how we all met together and started to work together, particularly with our colleagues and our friends in New Zealand and in Australia. And I also want to introduce Kevin Chu, who is at the moment or now for some time working as a Center for Livable Cities in Singapore. And obviously they're working on also, I assume, on very similar topics. And we know Singapore has a very good track record in terms of urban design, city planning. Before he moved to Singapore, he was working for the Human Cities Initiative in Stanford University, and he's still affiliated. And we know each other. He came often to CHK with his students, and we did public space studies here together. So I was very happy that we could invite you. And of course, you were also part, as many of the speakers here, in our webinar series before, from May to now. So without further ado, I am now passing the word to Kevin to moderate this session. So thank you very much.
Thank you so much, Hendrik. It's great to see you and to see everyone here today. Welcome to all of the guests to this session on cities and health, creating healthy neighborhoods. We have a great lineup of panelists who span the worlds of medicine, engineering, and public health. My name is Kevin Su. I lead the Environmental Sustainability and Resilience Research Cluster at the Center for Livable Cities, which is an urban think tank in Singapore affiliated with the Ministry of National Development. We're very pleased to continue collaborating with the Chinese University of Hong Kong and the Journal of Public Space in this ongoing dialogue. In earlier sessions during this symposium and in the series of fantastic webinars over the past several months, I think we've all come to recognize the importance of public space and its intimate connection to health and well-being. And this operates on several levels, space for physical exercise, in a pandemic, of course, appropriate distancing, increasing the probability of walking and biking when it's more convenient or accessible, access to oxygenated air outside of a sick building, mental respite from the urban jungle, even things like greater opportunity for social and commercial exchange in a vibrant neighborhood. And I think symbolically also, a very welcoming public space can telegraph ideas such as open expression of ideas, human agency, or connectedness to a community. And these are qualities which we should not underestimate at a time when people feel divided or disconnected or discontent. But during this pandemic, in many global cities, people were not able to access the outdoors. They were not able to be out and about on their lives. And as we will hear from our panelists today, this constraint on mobility has physical, psychological, and social implications. And so all of that means that there is a critical nexus between design and health, and also ethics. If people are stuck in their apartments without nearby greenery, or if migrant workers are feeling trapped in a cruise ship cabin with no windows and only allowed outside for 1 hour a day, or if public space simply doesn't exist or is commercialized and constrains where people are able to go, that does mean that a segment of the population is denied access. So I think that all pushes us to really re-examine kind of the quality of outdoor space, because not all green is created equal. And we need to look at human behaviors, how people experience space. Is it spacious? Is it relaxed? Does it accommodate activities? In short, is it meaningful, before we check off kind of green space requirements and declare victory? And so that's why kind of in this pandemic, we do have an opportunity to recognize this public health need and also accelerate our efforts to reclaim streets. Earlier this year, my team and I did a count, and we observed that about midway through the pandemic, more than 50 cities globally had closed off at least one street or lane to motor traffic and gave it over to pedestrians or to cyclists. And these efforts have proven rather popular, and many of the cities where this took place are actually thinking about making these changes permanent. And so that's a simple connection between health, urban design, and resilience. And while COVID has catapulted this topic much higher on the agenda, and it's what brings us all together today, it's not only a pandemic issue. And so for this session on neighborhoods attuned to health, our arc will begin with Professor Kim Dirks and her study of outdoor mobility during the pandemic and the exposure of pedestrians and cyclists to different types of air quality. Then Professor Lee Wilson will share her findings on behavior during the pandemic that will have not only short-term effects, but also long-term impacts on human health. And finally, Professor Albert Lee will help connect the dots further, and he'll start with a suite of data on COVID-19, but then stretch into what we might call peacetime and the need for the built environment for urban planning and design to address also social determinants of health. So I'm going to begin by asking Professor Kim Dirks to kick us off. Professor Dirks received her PhD in physics and environmental science, and she currently teaches at the University of Auckland in the Department of Civil and Environmental Engineering. Her research focuses on the impact of urban civil infrastructure on the health and well-being of city residents, in particular, air pollution and noise from road transport. And she'll be using this lens to kickstart our discussion of health. Kim?
Wonderful. Thank you, Kevin. All right. Here we go. Hopefully you can see that. No, not quite. There we go. Great. So thank you very much, Kevin, for that nice introduction and the opportunity to be here today to present. And thank you all for joining in. This photograph here was one I took outside the engineering building when I first arrived on campus after lockdown in New Zealand here, when I started in my new role in the Department of Civil and Environmental Engineering. And at the time, teaching was still being carried out online. Students were largely not on campus, but staff were allowed back in with relatively strict protocols put in place to ensure the minimization of COVID transmission. Needless to say, at the time, the roads and footpaths, especially on and near the campus, were pretty much deserted, much like you can see here. So while the topic of this session is a year without public spaces, I'll be talking about the ways in which the experience of lockdown in New Zealand actually opened up roads and footpaths, as Kevin mentioned, and transformed them into spaces much more akin to public spaces and less simply the traditional transport corridors that people tend to think of when you mention roads and footpaths. So I'll start by talking a little bit about the New Zealand COVID experience and the ways in which the use of roads and footpaths changed, and then focus on the consequences of these changes in behavior on air pollution exposure for people using these spaces. So by way of background, New Zealand announced its first confirmed case of COVID-19 on the 28th of February. The country received 2 days notice before entering lockdown level 4, which began on the 27th of March and lasted a period of about 1 month. So the photograph and words shown here appeared on the website of Radio New Zealand announcing New Zealand moves to alert level 4. Under level 4, as much as possible, people interactions were restricted to what was known as household bubbles. Travel was restricted to essential services only. Some buses were still running to ensure that essential services were able to get to work, but services were very limited and restricted in terms of who could use them. For people not deemed to be essential workers, this meant no travel except to collect groceries, medicine, and other essential supplies. Schools and university teaching moved to completely online, so there was no travel for education purposes. As such, traffic flows were considerably reduced compared with normal. The photograph shown here features a traffic exchange known as Spaghetti Junction, located in central Auckland. In normal circumstances, it's the busiest interchange in the country, but became completely deserted overnight when lockdown was imposed. So no doubt this type of photograph is familiar to many with similar circumstances in other countries around the world where strict lockdowns were imposed. Because of the need to maintain isolated bubbles, all gyms were closed and no organized sporting activities could take place. In order to help maintain both mental and physical health, especially at the time, as time moved on in lockdown, people around New Zealand were encouraged to go outside and get their daily exercise. Restrictions were put in place, limiting people to their immediate neighborhoods. So many people made the most of this time to ensure that they got some exercise. And certainly in my local neighborhood, there were many more people out and about walking, running, and cycling than you would have seen under normal circumstances. As nobody was meant to travel by car, even to their local park, most people just headed straight out the front door and onto their local roads and streets for this exercise. We're lucky in New Zealand that there's enough space for this, while also adhering to social distancing of 2 meters that was required, although the footpaths themselves were often very inadequate. As you can imagine, it didn't take long before the streets were, were very much taken over by pedestrians and cyclists, as in the photograph shown here. The unwritten protocols seemed to be that if you were running, you gave way to walkers by running on the berm when needed. And this often became running on the road when there were pedestrians that were passing in both directions. Children on bikes would typically travel on the road, and it was quite safe to do so in most streets because of the lack of cars. As well as being a great opportunity to stretch the legs and clear the mind, it was also an opportunity to see other human beings, albeit at a distance. People were largely very respectful, I think mindful of the fact that many people were having a hard time, so the be kind message became important throughout lockdown. So rather than being deserted as the motorways largely were, the streets very much came alive with people. Suburban streets became much more public spaces for physical activity, getting some fresh air, getting outside and seeing others, rather than being transport routes as such. While it's not very noticeable, wasn't very noticeable to me, people who suffered from asthma and other respiratory conditions and were sensitive to the effects of air pollution commented that despite their high levels of stress, they experienced much less in the way of respiratory symptoms during the lockdown, that they attributed to significant improvements in the quality of the air at the time. And certainly there was evidence of significant reductions in air pollution around the world as a result of travel restrictions imposed. So this example here from the news shows the spatial distribution of nitrogen dioxide concentrations, a pollutant that originates mainly from road traffic over France based on satellite imagery. The figure on the left depicts concentrations over the country over so-called normal conditions in March 2019, while the figure on the right depicts concentrations in March 2020 during COVID conditions. It shows pretty significant reductions in concentrations over a very wide area, largely attributed to reductions in road traffic. And Auckland was no different. So the graph here shows the drop in traffic observed for both light duty vehicles in light blue and heavy duty vehicles in dark blue in the period before and during the lockdown for State Highway 1 in Auckland, Auckland's busiest stretch of road. Flows of light vehicles dropped to about 1/5 of the pre-COVID levels, and flows of heavy goods vehicles dropped to about 1/3. Other roads could have expected different rates of reduction depending on the purpose of the travel, the vehicles that make up the fleet at a given time. But based on this, we could reasonably have expected a significant reduction in air pollution levels of a similar order of magnitude. This figure here was taken from a paper that was published in the journal Stoughton a couple of months ago describing the impact of lockdown on air pollution levels in Auckland. It shows time series of air pollution data for 3 different air pollution monitoring stations presented in the different colors in the Auckland region for 2 different pollutants on the left and on the right. One depicted in red is the inner city site. One depicted in blue is for a roadside suburban site. And one depicted in green is a background site located far from any significant source of anthropogenic pollution. The two pollutants, nitrogen dioxide is on the left and black carbon is on the right, both closely associated with road traffic emissions. And if we compare the period before lockdown with the period after, we see quite significant reductions, especially for the inner city site. Looking at the average concentrations for NO2, once again at each of the sites, this time over the course of the day, you can see significant reductions as well. The graph on the left is for the central city site, and the one in the middle located at the roadside site in the suburbs, and the green is the background site. The pink shows the historical average, and the turquoise shows the average over the lockdown period. So while the patterns of pollution levels throughout the day have stayed largely the same, the air pollution levels were significantly reduced during the lockdown period. Articles on air pollution were also published in the newspaper at the time, suggesting significant reductions. And this photograph here shows people socially distancing in the downtown area at a location very close to where the air pollution levels were measured for the inner city site that I've just shown you. And certainly doesn't look like too many vehicles in sight, at least in this photograph. As well as changes in behavior associated with the lack of travel by car, one of the other very noticeable changes was the need for socially distancing when out and about by foot or by bicycle. And for this, as mentioned before, the existing footpaths along many of the main roads were quite inadequate. And this meant that people needed to either walk on the berm or on the street in order to maintain the required distance. And this was okay during level 4 lockdown when there was very little traffic on the road. However, as we moved back to level 3 and level 2, the traffic levels ramped back up again, and the ability to socially distance using the available infrastructure became more difficult. And this brought about the need for some work looking at safety considerations for pedestrians and to find ways in which the current infrastructure could be adapted to suit our urgent, rapidly changing needs. For this, cities all around the world, including Auckland, made use of so-called tactical urbanism. In this case, planters and various temporary markings of sorts were used to change the layout of streets to cater for pedestrians, while also ensuring that social distancing could be adhered to. And this was especially important, as I mentioned, as we moved down to level 2, when socially distancing was still required, but traffic levels were heading back up again. Having pedestrians jump into the road to avoid people coming the other way wasn't really a satisfactory solution. Here's another example from central Auckland's Queen Street, the city's main shopping street, where temporary markers have been put in place to allow more space for pedestrians while still catering for buses and so on. Thank you. The advantage is that such fixtures can be put in place with relatively little cost and removed when no longer needed, unlike major infrastructure changes. So all of this has implications for air pollution exposure for pedestrians because of the spatially and temporally varying fields that people travel through. So the traffic flow dictates how much pollution is actually produced. The meteorology influences how much air pollution is, how air pollution is dispersed, and how people move through it influences individual exposure. Well, as it turns out, of critical importance is, in the case of pedestrians, is a separation from the road, with air pollution concentrations dropping off rapidly with increasing distance. So this is nicely illustrated in the diagram here, which shows air pollution exposures for commuters for the same origin destination pairs traveling by different modes. So the scooter, which is a moped, a motorized vehicle, and car travel in the middle of the road, bikes and buses on the edge of the road, walker and runner on the footpath, and the train commuter well away from the road for much of their journey. So the further the commuter is from the road center line, the lower the tendency for exposure. So when you start making changes to road layouts and where people walk with respect to the traffic, this impacts on exposure. There are other examples such as these where the road layout are being changed primarily for the purpose of putting in cycleways. but based on the previous graph, you can see how such changes would impact on the air pollution exposure for pedestrian commuters. The greater the separation, the greater the reduction in exposure to pollution experienced. As people move closer to the road in a bid to avoid getting too close to each other or walk on the road, then necessarily increase the amount of air pollution that they breathe. So the patterns of exposure to air pollution certainly changed quite significantly during the various levels of lockdown. So for the conclusion, so during level 4, the significant reduction in traffic flows led to significant reductions in air pollution levels, despite the meteorology being conducive to higher levels compared to usual. At this stage, the fact that people were walking on the middle of the road didn't matter too much from an air pollution point of view, because there wasn't much of it. Road traffic corridors turned into city streets and acted as public spaces for people to get out and about, and were in fact quite pleasant. As the lockdown moved back to level 2 and people started to head back to work and school, the traffic levels moved back up again. The challenge really was here when the air pollution levels were high again due to relatively normal traffic flows, yet the footpaths were found to be largely inadequate. All around the world, COVID-19 has resulted in changes in commuting behavior and use of footpaths and urban streets that will require ongoing adaptations and rethinking. So hopefully this whole experience will be useful for helping with momentum and completing and upgrading of cycle networks, improving wider footpaths that are separated from roads so that they provide safer options for those who choose to travel via active modes or simply wish to maintain their healthy habits of daily walking and life as life returns to normal. So air pollution exposure is only one consideration, yet an important one in ensuring adequate transport infrastructure for healthy urban living. Thank you.
Thank you very much, Kim. I'm so glad people have experienced less respiratory distress in some places, and it's great to find out that even a bit more separation can reduce the amount of air pollution that people are exposed to in our breathing. And so hopefully now that we know what clean air is like, we won't want to go back during the new normal.
Yes, thank you.
For the audience, there's a Q&A function. So if you have questions for Professor Dirks or for any of our other panelists, please put them in the Q&A by clicking on that button. Okay. And next, we will have Professor Lee Wilson from the University of Sydney. She has a PhD in behavioral science and a doctorate in public health. She is a senior lecturer in the Faculty of Health Sciences Aging, Work, and Health Research Group. She also has experience in the New South Wales health system as a health services manager and research study coordinator. And she'll be talking to us about impacts on wellness, including mental and physical health and long-term consequences of COVID-19 behaviors. So turning it over to Lee.
Thank you very much, Kevin, and thank you also to Hendrik and the Wooden Group for the opportunity to present to you today. I'm just going to give you a little bit of an overview to start with. I'll talk a little bit about the COVID state in Australia and then the impact of COVID-19 on the use of public space. As you're all probably aware, Australians love their public space. We're very much into the beach and walking in our national parks and being outdoors. And I think that this is one of the biggest impacts that has been a result of the pandemic, and I'll go through some of those issues with you. So in the Australian setting, Australians became aware of the overseas cases of COVID-19 around about December, January. At that time, we were under the threat of significant numbers of bushfires and floods. And I think that was actually impacting on a large percentage of certainly New South Wales, but the whole country. And I think really we didn't think that COVID-19 was going to be an issue for us during that time. And it wasn't until the cruise ship, the Ruby Princess, docked in Sydney on the 18th of March that we became aware that there were a lot of cases coming from the ship and also starting to come into the country via the airport. So we went into lockdown on the 23rd of March. Actually, that was actually called a level 2 lockdown here, although it was much more similar to the level 4 lockdown that Kim described. We had a surge in cases until around about May, when our case numbers started to drop off a little bit. But then in July and end of July and early August, we had a huge surge of cases in Melbourne. And Melbourne has gone down into level 3 lockdown until the 1st of November, and Melbourne is only just starting to open up now. In all states across Australia, we're still abiding by the 4 square metre rule, but mask use varies by state. So in Melbourne, for example, it's still mandatory to wear a mask outside, but in New South Wales, it's recommended if on public transport, but certainly the number of people who are wearing masks is actually quite low. So this is our current state. This was as of yesterday. In total, we've had around about 27,000 cases with 907 deaths to date. And this just gives you a visual picture of this first wave here back in April, May, and then the tapering off but surge in cases in Melbourne. And you can see here that our total numbers, of those total numbers, 20,000 cases came from that Melbourne cluster, and 819 of those 900 deaths also came from that Melbourne cluster. So at the end of March, some colleagues and I put together a research protocol to do a 2-phase study to investigate the impact of the COVID-19 pandemic on wellbeing and health. We had a rapid ethics clearance proposal go through as part of our special COVID-19 ethics committee. And phase 1 was an online survey using RedCap, which is a platform to collect the data to investigate the impact on lifestyle behaviours, mental wellbeing and physical health. And we used validated instruments to measure psychological distress, but we collected a lot of free statements as well from people asking about their changes in lifestyle behaviours and changes in their mental wellbeing. The phase 2 part of the study is a telephone interview with a subset of those people who answered the first questionnaire and who agreed to be interviewed at a further time. And this is really to investigate in more depth their responses in the first survey, but also to explore with them the use of public space during the pandemic and how public space and the use or not use of that has impacted on their health long term. So we recruited using a number of methods. We used social media, newspaper advertising, network email distribution. We went through our non-government organisations, Australian universities, student networks and flyers. And this is our flyer here on the right-hand side. So for phase 1, we had 175 respondents apply to our survey. They came from all across Australia. We were particularly interested in talking to people who came from Melbourne because of the severity of their lockdown. We had around about 79% of women in our study and less men, 21% men. But the women that were aged 18 to 45 actually made up 52% of that sample. And we suspect that that's because they were a group that was severely impacted by the pandemic. These were women who were working from home, caring for children, and still trying to maintain a work-life balance. So with the results from phase 2, to date we've done 10 interviews. We are hoping to get to 25. Those interviews have been recorded and transcribed, and they range in length between 20 minutes and an hour. We selected all ages, but we will oversample in that 18 to 45 year group, just because we know that they've got such a lot of issues doing that sort of juggling of family and work. As you can see here, this photo shows that all our national parks were closed for quite some time, and even now it's still, you need to be a kangaroo length apart from people. So our interview prompts were: how did you use the public spaces during the pandemic? And how did the pandemic impact on your usual use of public space? And you can see here that playgrounds were closed for quite some time, so that people were really unable to go out and use the public space. So of the people we've interviewed so far, the majority have felt that the use of places such as beaches and parks and walking trails, galleries, open spaces were severely restricted in the initial phase of the lockdown. And as a result, they now use public space less, even though local walking and exercise was encouraged and the public spaces are now open. So one lady commented, "I'd like to go out and do more, but there are still so many people that do not practice physical distancing. It still makes me nervous." And another said, "I'm happy to take my little ones to the park to play, but I sanitize all the time. The children even know how to sanitize and they're really little." I thought that was quite interesting too. So similar to Kim's images from Auckland, this is an article from The Conversation on October the 30th, and this is a view of Melbourne very recently before they came out of lockdown, and the impact that it's had on the use of public space in the city of Melbourne. So one of my other participants, when asked about how they use public space, one fellow said, "Well, I walked a lot more, I appreciated my garden more, but I tended to avoid public spaces because you couldn't really know whether there would be too many people around. I'm still very careful and physically distanced when I go out." And this is an image that I took in May when we were still in level 3 lockdown. I live very close to a popular tourist spot on the south coast of New South Wales, and these are tourists here watching the blowhole, which is a lovely tourist attraction, but you can see that there's not any physical distancing going on here. So there are situations like this that people are still very nervous of. I was sitting in the car, you can see I wouldn't go out. So some more results. Two participants actually thought they'd made really good use of the lockdown to undertake more physical activity and to feel better. One said that he bought himself a bike and started to ride every day because otherwise he was just sitting at his desk, and he said, "I don't do that in the office. I walk around all the time, I talk to people, I go out for lunch. It's really hard when you're in your own home. Now I ride the bike everywhere." So this was one really positive example of a change that someone had made, that they were going to continue to ride all the time. And 3 of the participants were very disappointed when their gym closed down for so long. And one said, "I got online and bought myself a treadmill and some weights. It's great. They were delivered without contact, and now I have them at home as well. I've even been doing my Zoom meetings on my treadmill." And I, in fact, have a colleague who does this as well as this participant. And you can see him just bumping up and down in the Zoom meeting as he walks on his treadmill. So in conclusion, the use of public space was really severely limited during our initial lockdown. And the impact of this has led to a long-term impact on the use of public space. There seems to be a group of people who are still quite hesitant about going out and using public spaces. And this is related to the physical distancing issue. And then there are those that felt so trapped during that lockdown period that they're now very keen to get back to that normality and to travel to areas like the tourist spots and like places that they'd like to go and see. But there's still an issue around that physical distancing. One of the things that we need to really think about here too is what are the long-term impacts of this? And we're going to do this study as a continuing study and follow people to see how they go back to normal and what their usage of public space is going to be. Because it is possible that the behaviours that people have picked up during the pandemic have quite a significant impact on their long-term health, and whether that be on their mental health or on their physical health. And I haven't had time to give you some of the data from the first phase of the study today, which was about the mental health and physical well-being, but certainly that showed a very significant impact in terms of an increase in depression, a decrease in satisfaction with life, and also an increase in the uptake of adverse health behaviours, so things like increased smoking, increased alcohol consumption, and behaviours that are not a good long-term, don't have good long-term outcomes. Thank you for that. Thank you, Kevin.
Thank you, Lee. I think some really great insights there from users of public space and the different concerns that they've experienced during this pandemic period. And we look forward to the next phase of the study as you recruit more participants and kind of look toward the long term. Our third panelist is Professor Albert Lee. He is a practicing clinician and educator in family medicine, health promotion, and disease prevention. He has a medical degree from University of London and doctorate from the Chinese University of Hong Kong. Dr. Lee focuses on promotion of child and adolescent health through school settings, linking to community and primary healthcare. So Dr. Lee, could you please give us the perspective from Hong Kong?
Okay, thank you. Okay, thank you, Kelvin, for a kind introduction, and thank you, Hendrik, for organizing and inviting me to share. Hold on, let me get back. Sorry, still learning the new technology. Okay. Okay, I think thanks for also the wonderful presentation by Kim and Lee setting the scene. And now I think I'll talk a little bit about the Hong Kong scene and how I will see the impact of city development and health, and how we do it, as both Hendricks and Kelvin mentioned, under the peaceful time. I think when you look at the UN Sustainable Development Goal, and number 3, and good health and well-being, it cannot really happen without sustainable city development to ensure our population have a safe and healthy environment to live and being more resilient in terms of health and well-being. And during the COVID-19, as already been mentioned by Kim and Lee, that a lot of measures like restriction of social gathering and some physical measurement of the physical distancing. I like to use the word physical distancing rather than social distancing. And even the lockdown or shutdown measure have a impact on the stop the acceleration of the epidemic curve. But then what could happen to the general population in long run? I just think one of my colleagues, Dr. Ben Fong, actually is Aussie as well. I was from Hong Kong. He graduated from Australia and was one of the health administrators of Princess, I think it's Alexandra Hospital in Sydney. He returned to Hong Kong, and he's a public health and also a primary care physician. He now is working as a lecturing in health study. And he did a study among the young students not long ago, right? And he found out that over 60% of the participants experience increasing stress staying at home. Those are mainly teachers and students. And nearly 30% have moderate severe degree of depression and increased use of electronic devices and decreased outdoor activity. All these are found to be positively associated with high level of depressive severity. Well, we must not forget the importance of physical activity, maintain healthy diet, healthy living, leading to the changes, not only the positive change to physical health, but also the important, the mental well-being as well. So in other words, we need to be a little bit more innovative and creative. How could we make use of more open public space and still facilitate social interaction while at the same time we allow adequate, what we call physical social distancing? Now, I'd like to take back the importance of built environment and risk factor for health, being a doctor, also a public health physician or practitioner as well. And that's why I got interested in working with all of you. And if you look at the global mortality and morbidity, all right, and environmental factors is one of the key factor affecting the global mortality and morbidity, together with the behavioral factor, metabolic risk factors. And obesity is again related to our built environment, right? This is a big burden, I think, in Hong Kong, Australia, New Zealand, even in China, Singapore as well. The high body mass, overweight, obesity increased over the last 2 or 3 decades, and it's really related to physical inactivity and healthy eating. And it's brought down to the space, all right, public space for physical movement. And we worry about non-communicable, although we worry about infectious disease, but let's not forget, and in fact, the non-communicable disease causing even greater mortality and morbidity every day, all right? Being a doctor, I'm still worried about my patient with heart disease, I worry about my patient with diabetes and chronic lung disease, and they still need to be looked after. I'm still seeing some patients that had been telling me that they really worry that they have to come to the hospital to see me, but they also get worried if they can't come to see me. So it's just in a way, a little bit schizophrenic in their mind. On one hand, they really want to come to see the doctor, but on the other hand, they really worry. But again, those non-communicable disease, or we call NCD, the main driver is really brought down to physical activity and healthy eating, which is closely related to the places where we live. And sometimes it's the industry opposing the public health intervention, right? And you all expect the built environment have been shown to increase obesity, right? Dealing with the more greater use of the car, and because of air pollution being mentioned by both Kim and Lee, by now the air is much cleaner and people more could actually enjoy a little more physical outdoor. And in our part of the world, the pollution is another burden for getting people outdoor, right? And the density of our population and street connectivity all can make walking attractive or not attractive. The urban sprawl have been found to have association with physical activity, obesity, and how we design the city. If we are little concerned urban planning, you could end up a city that very modernized and a lot of facility, sounds like an exciting place to live, but they may not be conducive to both physical and mental health. Okay, and a lot of time is the city design could dictate the amount of time available for physical activity, how accessible we are to the park and fitness. I always love to travel to Australia and New Zealand because I always have no difficulty finding green space and park to walk. In fact, I was in Sydney just before the lockdown in early March, all right? I always enjoy walking along any the green, exposed green space, and there's no, usually it's not difficult at all, right? And I think in the northern part of the Western Pacific, where the city is more densely populated and our urban design so jam-packed, and finding distance not only for walking, sometimes as connectiveness to the finding easier to go to supermarket rather than the wet market, all right? So in a way, how you can get access to healthy food also a problem as well, okay? So at the same time, let's not forget about the labor code, about the physical side, the social side, all right? The lack of, although we are we're quite well developed, all right, in a way, in Hong Kong, or in many cities in Asia, but in a way, the labor code, right? People are not well connected psychosocially, right? Then they have many buildings, they seem to be very close to next door labor. Then in terms of connectivity, in terms of social perspective, it's I think getting weaker and weaker. And in fact, it's decreased rather than increased social capital, all right? So it's been found that increased social capital have an impact on lower level depression, less reported substance abuse, and better weight management, all right? So I think if we have perception of high social capital to find out also correlate with better mental health as well as physical health, is how is a social cohesiveness of the people living in the community. So I think that's why I'm interested in review the expertise from the town planner, urban designer, how to make the built environment not only adequate physical space, but also in a way build up the social capital. And I will run very quickly about the food security. Also, the way we design the city could have an impact on how we could access to healthy and fresh food, all right? And it also depends on the labor code, and we are now exposing our population to more and more convenience store fast food outlet that could lead to obesity as well, all right? And so in a way, this repeat again, we cannot achieve SDG free for health and well-being without making the city and human settlement more healthy and more safe and greater resiliency for good health. I think they go hand in hand. Coming to a topic I may have been doing for the last 2 or 3 decades, it's a healthy city movement. I took a quote from my friend John Ashton. He pioneered the healthy city in Liverpool. Is the one the healthy city is trying to improve the physical and social environment and to make use of the community resource to enable the local population to perform all functions of life, all right? So it's a bit more holistic approach. And during the phase 4 of the WHO European Healthy City, you talk about how you create a supportive environment, how to provide opportunity and condition for the people to live healthily, leading the healthy lifestyle, And the more important is how do the built environment could support health. All right, the health in a sense, not just physical health, talk about well-being, safety, social interaction, greater mobility. They take pride of the city, and there's a sense of belonging, and then also the city development respond to the needs of the citizen. And the WHO Commission on Social Determinants of Health, led by Michael Marmot and also Sharon, actually currently working at the ANU, and understand the urban setting, right? It's a major development, but to understand what are really the social determinants of health, and we establish a knowledge network. We have a meeting in 2007, and then we have a few recommendations and to maintain the urban city become more healthy and sustainable in terms of development is building a social cohesion, improve the environment, better accessible to primary health care, and using the healthy setting approach, and more proactive and more coordinated in urban planning and the governance of the urban setting. I just want to quick share with you some old data of 2 districts in Hong Kong. The reason I choose Hong Kong has 18 districts, all right? And I choose 2 districts, they have some their uniqueness. The Central Western District is on the Hong Kong Island, where the first British settlement in Hong Kong back in the 1842 when the British first arrived. And Central and Western District is now there's a major financial hub. And so it's been developed over 1.5 centuries as a start off as really first urban city in Hong Kong, all right? And we look into the 4 components of quality of life measure, how the population perceive the physical health, psychosocial health, social relation, environment. And we found out that in terms of psychological health, we've been ranked quite poor, right? And also in terms of how they rank social relationship environment. In the Central Western District, which is quite the rich part of Hong Kong, the financial hub of Hong Kong, especially among the young people, all right? But the old people, they don't feel that, well, not that bad compared to young people. I think in a way, when I wouldn't have time to go through the detail, when I did some focus group, and some young people mentioned that with the development as a financial hub, they lack the community resources for the young people. For the older generation, because of the improvement of city development, in fact, in the 19th century, those old people live really in poverty but now with the development, they gain the benefit, while the younger people losing out with urbanization. They seem to be drifting out of the development. All right, I'm talking about young people as a whole, not those just office worker. But old people, they tend to see the benefit compared to half a century ago. So you can see the old people tend to be more satisfied than the young one. Now look at the Lofton district, which is close to the border of mainland China, and which used to be a rural area at the day when I was young. All right, that was a few decades ago, over half a century ago, right? And now it's become turned into urbanization, okay? All right? And on the other side, you see the other way around, the old people and the quality of life in terms of the particular psychosocial health, social relationship environment is much lower. Because when you develop a rural area, the young people will be more happy, right? Because it no longer is a village, a lot more excitement. For the old people, they feel that, and they've been replaced. You know, they used to enjoy the old way of life in countryside and the neighborhood solidarity. But now suddenly, because of urbanization, they seem to be segregated from the mainstream society. So you could see in a way urbanization also, when you develop, you could bring the benefit if you plan it well, that you could cause some detrimental effect to certain sector population. For old people, with those people already, like the Central Western part, they usually live in poor condition. Urbanization help them to live up. In the countryside, which they've been living happily, when you put in urbanization, you may put their life more difficult, right? So just an example. So I think I would like to finish off with some of the latest initiative healthy city, right? I talk from the Kuching statement reflect the Western Pacific part, all right? And I think really understand the health, we need to take into account of physical and social factor, right? There's a big call for action, all right, across the whole society, and particularly social factors, not just the physical factor, the social factor. You don't just work on the health sector, you need to work across the whole society, all right? And the Kuchin statement mentioned that important understanding the urban development, how the ecology, economic development, and the social aspect of human development linking with health. So when we talk about healthy cities, it's not just the health service. When we talk about right to health, I've been talking to some classes last few days. When you talk about right to health, it's not just right to the health service, it's the right to the healthy living condition. When you talk about healthy living condition, you really need to connect up the ecology, economic development, urban design, and the social perspective of the human development, right, in order to build a really healthy state across the whole society. Oops. Sorry. Oh. Okay. And recently they have a meeting, the European have they developed a Copenhagen consensus on among the city mayor how to make a healthy, happy life for all citizens. And during the phase 7 of the healthy city development in Europe, the statement was released in 2018. I think they talk about investing in people, to make the city more healthy, and they put a lot of emphasis on urban design, how to improve health and well-being. More important is greater participation and partnership. All right, they talk about partnership in health. The partnership is not just within the health sector, not just talking about partnership among the different disciplines of health. Is how the partnership, like myself with the engineer, architect, and urban designer, or some advocate for better urban development. And then basically we need to look at community to assess health service in only one facet of health, but some common goods and service, like are they access to healthy food? Are they accessible to the park? Could they commute? Increase walkability? That's something that Hendrik's been working on a lot, right? And those are the sort of things we're looking for, all right? Walkability, are they isolated? Could they access to the day-to-day product for basic living? And well, Hong Kong, at least one thing, we are quite safe in a way, quite peaceful. Then peace and security is still important, right? And most importantly, we want to preserve and conserve our world, our planet from further damage and degradation through, as Kim mentioned earlier on, the pollution. I see in a way how sometimes when we lock down, but we could see more clean air, blue sky, and things like that. So I think we want to maintain, all right? Right. Of course, we don't want it because I've heard this kind of cries to make us to force us to shut down our factory, get our air more clean. But I think we need to think a long term. How could we protect our planet for further damage, and how could we have a more sustainable development? And those are the sort of things we should look into. Okay, sorry. So I took this picture. I think in Hong Kong, and I'm saying, okay, we are a vibrant city. And the reason that I show you, this is one of my friends from Scotland, and Ian, he came to Hong Kong and he took some nice pictures. Those pictures are taken by him, right? And we in a way, we improve our hygiene, but we still have a lot of beautiful environment in Hong Kong, all right? In some, we could make our city, all right, as a dynamic city, vibrant city, as well as also green, hygienic, and healthy place to live. On one hand, we are urbanized, but I think our transportation system, accessibility, and it's really about time we could plan our city in a better way to make to take advantage of urbanization and to help the people access to the sort of thing they need to be they need to access, and in a way maintain health and well-being and living in a decent life. I think we could make a balance of both. So I think we echoed by the other two speakers. We really want to set the highest value, not just living, but living well, okay? And I'll take a little bit advertisement with my book coming out probably early next year on healthy settings, how to make use of different settings to make our life more conducive to health and well-being. I think I will finish here. Thank you for listening to me. Thank you.
Thank you, Albert. You've stretched our conversation into thinking about this new normal, and we can see that cities and health is a continuing issue that links everything from food habits to different age groups, and even broader questions of social cohesiveness. I think we'll move into the Q&A portion of our session today. For the audience, if you have questions for the panelists, please type them into the Q&A box and we will ask them. I think to just kick off this conversation about the Q&A part, I think we have people from different backgrounds here, right? We have faculty teaching in engineering, medical school, kind of more public health oriented. So from your different disciplines and from your research perspective, could you name perhaps just one or a handful of indicators of health that you think we should be paying attention to, particularly from a planning perspective? And how could we use that indicator to influence planning or local design or even political decisions? And if you think about that indicator or set of indicators that you're suggesting, what is the scale where you think it should operate? Is it something that relates to the streetscape? Is it more of like a district planning issue, or is it kind of a citywide question? And I think it'll be interesting to kind of hear from the different panelists what a health indicator for you would be. Who would like to give our first response for that? Thanks, Lee. And then we'll put Kim on deck after that, and then Albert.
I think the issue of social connectedness as a determinant of health is really important. And I think Professor Lee and also Kim talked about the issues of social isolation and social distancing as well, or physical distancing. And I think if we make supportive environments that actually encourage people to be able to still connect with others, that's probably the thing I would think would be most important, that we make those environments a safe space for people to go out, because we don't know how long we're going to have to stay apart and how the length of doing that is going to actually impact on the way we interact with others long term anyway. So I think creating safe environments and safe spaces is really important.
Thanks. Kim?
Oh, yeah, tricky one. I mean, I was very interested in looking at the whole sort of multiple aspects that was going on in terms of changing nature of the streets. So in some ways the air pollution levels were better when there weren't any cars there and people were out and about. But certainly the social connectedness was really big, and the increase in the exercise levels was really important. And somehow, in some ways, the air pollution and the exposure sort of stuff that I'm often interested in kind of went away as a problem, and other things took over. So in terms of different behaviors as people are out and about, I mean, we should be looking at, there's things like accident rates. We haven't really talked too much about that. That was always on my mind. That's something that could be quantified. I guess it's sort of a health outcome in a way. So I mean, to me, that's a big one. In the long term, it'd be really nice to see people carry on with their exercise, and we sort of rethink how we encourage people to carry on with their cycling and their walking. I think travel by bus has used to be a big thing, the whole public transport, but now people seem to be put off a little bit by public transport, and hopefully to the benefit of people walking and cycling, and not people choosing to hop back into their cars again, which is a bit the tendency in places like New Zealand. So measures, exercise, I think, I mean, that's a big one, I think, and accident rates.
Thanks. Albert?
Okay, I think I very much in line with what Lee and Kim has just mentioned. I think the social connectiveness is important. Building on the accident, yes, the injury is very important. Apart from that, the crime rate I also think is important. Something we take proud in Hong Kong, despite a very urbanized city, we are still a safe city. The crime rate, they all go hand in hand. The accident could be due to the intention and unintentional. And I think another several indicator we like to work in terms of engagement, outdoor activity. Right? We want to get people more in the outdoor activity, less time spending on sedentary lifestyle. I think those are the important indicator. And also in terms of the quality of life and life satisfaction and accessible to healthy food product. I think that's another indicator, because thinking about the diet, nutrition, physical activity, the air quality, accident, those are the major determinants of health. I think we should in every urban design, we should put those indicators in.
Great, thank you. So some of the questions from the audience now. The first one, I think is actually linked closely to a second one. The first one is, what do you feel could be some of the long-term changed habits of how people function in urban life? And I think you started to hint at that already. And then second of that, another audience member is asking, do you see a need for common citizens to have a developed sense of healthcare and knowledge of health, rather than only being limited to doctors and experts? So one is kind of long-term changing behaviors, and then second is maybe a different sense of what health is and knowledge of health.
Maybe I tackle the first two questions first. I think absolutely important in terms of the knowledge, all right? The health knowledge should not be limited to doctors. I think that's why we work in Healthy City, Healthy School, is basically improve the health literacy of our community, right? I think that's the most important. We want to, another thing, I think we should measure the health literacy. That's another indicator. So long-term change of the habit is to improve the health literacy of our population. So not only the knowledge, so they acquire the skill to understand how could they help themselves to lead a healthy life, how could they choose the product, how could they push or pressurize the policy to make healthy choice, easy choice. For example, walking distance become readily available, things like that. So I think in long-term changing habit, come back to the answer in the second question, the knowledge should not be just limited to healthcare professional. It should be the improvement health literacy for the whole population. See any?
Kim or Lee, did you want to jump in on that as well?
Yeah, I mean, I think in terms of the long-term habits, what was seemed to be quite stark anyway from my impressions of people's experience with COVID is that some people came out really well and actually changed their habits. And Leigh was mentioning this, you know, some people change their habits for the good, and it's a question of trying to maintain those. And other people, you know, it was very, very difficult for them, and things got worse. So in terms of, that was, I think, was quite interesting in terms of how it polarized people. But yeah, the challenge, keeping that going. So once you picked up your exercise habit, keeping them going when everything else sort of goes back to normal. Yeah, I don't have any solutions for that, but yeah, sometimes it's a question of kick-starting it. So hopefully it'll carry on.
Yeah, I think that's exactly right. Yeah, I think it's a matter of just observing and seeing how things pan out, you know, long term as things do become more normal. But I agree with Professor Lee. I think it's about making good health everybody's business. It's not just the experts, it's the schools, it's everywhere we go. It should be a big focus. And unfortunately, in this country at the moment, preventive health doesn't have the priority. It's always response to acute care. So it's very difficult to get that preventive focus with, you know, the current approach that we use.
Thanks. Okay, so we have a few more audience questions that are coming in. Please do use the Q&A button if you have any questions to ask. And if there's a specific panelist you would like to answer, please do indicate that in your question. This question is for Professor Wilson. Does your research help estimate the proportion of the population that are afraid to return to shared open spaces, and how should we address this as a community?
Yes, we're hoping to do that. Unfortunately, our sample size is quite small, and we were hoping to get a much larger sample. But we are able to do, and we haven't done this yet, but we are able to actually look and break up from our data how many people are feeling that they won't, you know, they don't want to go back to normal, and how many of the people are actually quite, you know, looking forward to going back to normal. So they will be things that we will be doing long term, and our paper's currently in publication. So hopefully that will be out before too long.
All right, thank you. Our next question is from Sujata Govada. I think kind of a two-parter, one related to New Zealand. Says, with proper education and awareness, should the parks and public spaces have been open during lockdown as in New Zealand? Obviously, masks and social distancing should actually be followed. And then the second scenario that she posits is, could 50% of the road network, or is there a scenario where 50% of the road network is reclaimed for biking and walking? What's the impact on the quality of life, health, and well-being of people in cities? So I guess we'll turn it to Kim, since there's a New Zealand there.
Oh, thank you. Yes. I mean, the parks, the idea behind the parks is that they wanted to make sure that people, most of the parks people have to travel to drive to. So they wanted to avoid people sort of moving between regions. So that was the idea behind stopping people using parks. So people actually, if it was right in your immediate neighborhood, you could use it, but you weren't allowed to travel to one. So that was the consideration there. There was also restrictions in terms of activities like boating and things. They just didn't want to have any sort of extra emergency requirements to sort of, so anything that was a little bit dangerous, you know, was not allowed. So there was that aspect of it as well. I mean, it would be fantastic if our roads could get smaller and our cycling and our walking could get bigger. I mean, I would just, I don't know what the, you know, don't know how you make that happen, but that would, to me, that would be marvelous. You know, if we could move towards move in that direction. Cycling is picking up in New Zealand, but it's taken quite some time. But here's hoping. 50% sounds great.
Albert or Lee, did you want to jump in? Okay.
No, I'm fine. Yeah, that's good.
Okay. So another question then, as we're thinking about these public spaces, is particularly this issue of access and how perhaps we might measure access to public spaces, as well as, in addition to kind of just checking off like, oh, there is access, also thinking about the quality of public spaces people are able to access. So, you know, from the perspective of your city, how would you want your city to think about access, and what are some of the basic standards you think we should be setting for people? I guess we'll toss that to Albert first. Yeah.
Okay, I think when you look and measure accessibility, I think it's also really when you consider is it barrier free, especially in Hong Kong context, all right, because we are urban city. So you know, when talking about accessibility, the park will encourage elderly to be more mobile. So I think we look at whether there's access in terms of barrier free and also user friendly, and the hours of opening. Those are really technical issue, all right, and how likely they could be connected to the park and green space and things like that. And in terms of the safety, and in terms of safety, I'm not talking about the crime rate, the safety, maybe in terms of safety, where the pathway is too bumpy and things like that, where it's safe for the children to go around. And those are the sort of issue, I think, and in terms of urban planning, and do they really have to travel, as Kim was mentioning, we don't want people to drive and to take a bus for a long time to go there. We really want to, within walking distance, they could also enjoy the distance going to the park and the open space, and then within the park or the open space, they could move around safely for all age group, all right? And the facility target for different age group and become a very user-friendly way. That's my sort of, in a way, criteria for accessibility to this kind of open space.
Kim, and then we'll have Lee on deck.
Yeah, I mean, I guess it's a question of what type of public space we're talking about. Certainly in terms of all places, pretty much within New Zealand, there is the opportunity, and particularly under COVID, I mean, everybody could, the inner city was a little more tricky, but pretty much everyone could actually get outside and sort of get some fresh air and experience a bit of space. In terms of quality green space, it's there's quite a lot of it in New Zealand, but it's also not terribly well socioeconomically distributed. And certainly if people have cars, they can actually drive there and get to some pretty nice parks around the city, but obviously that's not possible for some people. So there is an issue around the distribution of good quality green space. Yeah.
I agree with that totally. I think it's very much dependent upon where you live. And I think some of the newer developments in Sydney have catered for that, particularly where they're developing existing original farmland. They have tended to incorporate green space into those developments. One of my concerns, and has always been, is that in the more urbanised areas where we're now developing old residential blocks of land where there was just a freestanding house that is now a 15-storey apartment block, there is no requirement to maintain green space in that redevelopment. So it's increasingly becoming less and less able for people that are in that highly urbanised area to access green space in the city, and that is a concern.
Thank you. Our next question, I think two different audience members were interested in the idea of social/physical distancing, but then also the implications for isolation. So Shayla is asking, how do we navigate the idea of distancing without feeling increasingly isolated from society? John, from kind of another perspective on this, social interaction and connectedness are usually advocated in public space design. But then what are our views on these new forms of more remote relationships? And how do we respect the humanness in physical social distancing?
I think that's a really interesting one, and it is a challenge. I think certainly for Australians, one of the hardest things that we've had to do is to stop shaking hands or to stop hugging people that we know. And so there is that human element that sort of has gone a little bit, I think. But in relation to the public space, I think we need to make it, as I said before, we need to think about how we can make those public spaces really user-friendly and encourage people to come and socialise and connect with others so that they don't feel that they're isolated within that whole sort of social setting. I think we need to think about how we design those spaces. And for me, that's one of the beauties of working with this group, because we have architects and engineers and medical experts and health people, and everybody looks at a problem from a different lens, through a different lens. And I think it's really good to work together in that sort of setting.
Albert, did
Yeah.
you want to?
Yeah, I think kind of now remote sort of connection, like the virtual meeting people, virtual world, I will only say it's a fallback, all right? It's better than nothing, but we can't take it as a mainstream. For example, I don't think that teaching student and Zoom teaching, okay, with alternative, but still face-to-face interaction is still very fundamentally important for human interaction. And I think and come to as echo from Lee, I think we could see from the different perspective how to make the public space from the medical perspective well ventilated and make sure it's minimize the impact of the transmission of the infection, and also in terms of adequate spacing, and at least allow people with reasonably good physical distancing but maintain the social interaction. Because for the elderly people, if they keep being isolated at home, not only the emotional problem, the mental health issue, but physical mobility gone down, they may have more likely to be the joint problem, and they stay at home, then exercise, the blood pressure may grow up and put them increasing risk of heart disease or poor control diabetes. And for the young people, increasing use of internet. I don't go about drug and alcohol, but just increasing use of internet, and it could have a detrimental impact on their health. I think so. In other words, we need to start planning, we will have fourth wave or another wave or another disease coming in. How we could still interact in open space, face to face, in a safe manner. I think that's something we need to plan ahead now.
I think one thing that I found quite intriguing was when we had in Auckland, we had two waves of lockdown. One was the more serious one to begin with, and one was a shorter, less severe one later on. But the interesting for me was that during the first lockdown, nobody was encouraged to wear masks, whereas in the second one, they very much were. And I found it quite strange going out into public spaces and doing the usual thing that we did during the first lockdown. When people were all of a sudden wearing masks, and there's something about smiling at someone that puts you at ease and makes you feel comfortable and more safe than when you can't see someone smiling. So I found that really quite weird. So I think we need to find a smiling alternative, right? Some other way of signaling to people that we're not threatening in a way. Yeah, so I found that one quite interesting. They have now developed masks that are see-through, aren't they? Sort of plastic ones, so you can actually smile through them. So I think those are quite neat, and for me, that's a big step forward. I mean, the other thing that was quite interesting would have been everywhere, but when you met someone coming in the other direction, you know, the polite thing now is to sort of jump out the way, isn't it, to give them their space, because that's the expectation. If you don't move out the way, you're being rude. Whereas, before pre-COVID, if you jumped out the way of someone and made a big wide berth, it's because you didn't trust them, right? Because you thought that they were suspicious looking and you wanted your distance. So there's some quite strange changes that have happened in terms of the whole social distancing that I found quite intriguing as I've gone out and done my daily walk or daily run. Yeah.
Great. We have a question here which says, which actors or stakeholders do you feel have importance in encouraging people of various types to increase their quality of life using the different ideas that have been raised today? So essentially it says, how can we understand a framework of implementation where we take the ideas that the panel has raised to the city? I guess, Albert, do you want to start this one? And then Kim, then Lee?
I think in terms of the stakeholder, obviously will be the citizen, the people living in the city. They're the key stakeholder, all right? So I think the important actor, a healthcare professional could provide some evidence-based information, all right? What works, what doesn't work. I think the policy maker, the politician or policymaker need to take in the scientific information, right, in terms of hard science and also from the evidence from the social science, and then to put in to make a what we call strike the right balance. All right, I think when of course let's say on one hand, and when you talk about the green environment, green industry, that some of the industry may oppose because escalating costs. I think for the policy that me as the policymaker need to take in the scientific information from different perspectives, from the medical science, engineering science, social science, political science, and put all together and to find out the balance, which way you should go to the greater benefit to the population. So we got in a legal term proportionality. Whatever the action is a wisdom, political wisdom, is proportion to what's happening now, and take into account the view of the stakeholder, which is the people using, living in the city, operating the day-to-day life in the city. So I think taking into account the stakeholder, drawing on the later and some of the science from different perspectives, and try to strike the right balance. I think that's my view.
Great, Lee. What is your view on the stakeholders?
I think similar to what I said before, I think we need to make preventive health everybody's business. And unfortunately, it's not always a priority. And I think Cecily is right. It's certainly about the policymakers and the framework that we make at a broader level to address these issues. And I think from my perspective, in that sense, the stakeholders there would be the people that have the best evidence, the experts, the people that are involved, as well as our population as well. I think it's make it everybody's business and make it important.
So nothing more from me on that one.
Great. Well, that was a lot of Q&A from the audience. Oh, I guess there's one last question that we'll ask, which is, given all of the work from home, does any of the speakers have some thoughts on moving to these ideas of people moving to suburban areas and countryside for better quality of living? So I think kind of maybe the context for that is we've seen increasing urbanization in recent years, but the question then is there going to be more suburbanization or even moving to the countryside for better quality of living?
I think that's actually happening now, to be honest. It seems to be that there's a lot of people who are leaving the city as a result of the pandemic, and a lot of the more suburban areas and countryside areas are growing quite exponentially because people can work from home and they can manage their lives differently, I think, in a less stressful way as well.
People have more options, don't they, now? I think if you know that you're only having to go to work 2 or 3 times a week, you're happy to travel a bit further if that's what you need to, and if it can be flexible, then that makes a really big difference. So I think people are thinking more broadly about perhaps where they'd really like to live rather than where's more convenient to live. So I do think we'll see some big changes there.
Actually, when you move out the city, like you move outside London, I always make a joke, you want to be a neighbor to the Queen in Windsor. It's far less expensive than living next to Buckingham Palace. But unfortunately in Hong Kong, even moving out suburban areas is still expensive to live. That's another fundamental problem in Hong Kong. But I really, if I have a choice, I'd like to live further away and only go to work a certain time, organize my schedule. But unfortunately in Hong Kong, the incentive of being less expensive, even our Landmark Island or Lantau Island is still expensive. I think the cost of living in Hong Kong, I think it's better in Singapore in a way than Hong Kong, right? And I think definitely find more flexible living environment is important.
Great. Well, thank you to all of our panelists. I think we're coming to an end of our Q&A segment then. So to wrap that up, then if you could each just give us one final thought that you would like the audience to take with them about healthy neighborhoods, healthy cities, and what we can expect moving forward. So I guess we'll toss it to Kim first, and then.
Oh no! Put me on the spot.
Oh, okay.
I think the important.
Someone else like to go first?
No, it's okay. I
Okay.
mean, I think the important thing is that we need to learn in terms of the ways things have improved since the lockdown, and just make sure we carry on with those positive habits, right? So if there's things that have worked well for people, we need to learn from that and make sure we need to learn from this whole experience, right? It's been tough, but let's take the most out of it and push forward with all the benefits that have arisen.
I agree entirely. I think it's about caring about each other too, thinking about all the things that we've learned about ourselves as people during this 6 or 9 months, and taking it forward. You know, learning from the experience and benefiting from that.
I think my message is engagement to the whole community to find a solution to face the challenge, and everyone will have something to contribute and get them all engaged.
Great. A big thank you to all of our panelists today. Just many insights from many diverse fields. And I think it's very clear through all of their presentations and their remarks that we do need to include health as a value in how we plan for our cities, and should be an important factor as we kind of keep shaping both the physical environment, but then also our societies. And just for the audience, thank you for joining us today. I hope that all of us can kind of keep thinking about how we reimagine our cities as places that are health sustaining, health promoting, and then also some interesting questions that did get raised too, and kind of connecting health to other priorities such as, say, climate change or resilience. If people are moving into suburbs, how can we make sure that's done in a way that isn't damaging to the climate, even as people are living and working remotely? Can it actually be something that is good for the planet as opposed to something that would hurt? And I think this theme has been brought up by all of our panelists today, and I think it's worth reiterating, but it's kind of an open question, an open invitation to think about how we work together, whether as medical doctors, public health specialists, infrastructure engineers, urban designers, sociologists. How do we really keep this dialogue going and build the insights from one field into other fields and kind of take it on as part of our everyday work? And so hopefully as a community that has gathered here today, we will all continue these joint efforts together. So thank you to all, and turning it over to Hendrik for concluding.
Stephanie, I think is, yeah. Just thanks from me also to all speakers, but I think Stephanie will announce the next point.
Yeah, so thank you, Kevin, for the great moderation as usual, and thank you all speakers for the insights. I just want to wrap up the session by announcing what we have up next. Actually, in an hour, a bit more than an hour, we'll be having another session on the bigger theme, cities and health, but this time we're zooming into health disparities, and especially in higher density and informal communities. So we'll actually have a quite interesting mix of speakers representing Hong Kong, India, and Lebanon. So it's really going to be quite an interesting composition. So stay tuned. I'm just going to post this, our website again on the chat, so that if you're interested, you can register for that specific session. And towards the later part of today, we also have a final closing remarks session to reflect on the year. And actually, towards the end of the conference, we have a virtual tour of Hong Kong public space. Just to, you know, as always, conference has tours, and we're just doing it in a new way with a virtual tour this time. So if you're interested, you can still sign up for free on our website, and you'll receive a Zoom link right away after your registration. So that's all from my side, and we hope to see you in a bit in other sessions.
Okay.
Okay.
Thank you.
Thank you.
Thanks,
Good day.
Ken, and
Yeah.
Audrey,
Thank you, Kevin, very
See you all.
handsome.
and
See you all.
audience also. Yeah. Okay.